If you've just joined us, our guest on this episode of Question Time is the Honorable Minister of Health, Professor Isaac Adewale. Don't go away. You talked about awareness. How would you assess the level of awareness of an average person living in the 10 states where we are having an upsurge of this Lassa fever?
I think we should not confine ourselves to the 10 states. My concern is that we should concern ourselves with the entire country. I think we lowered our guards after Ebola. And our warning is that at all times and in all places, we should maintain a high level of hygiene. Wash the way we store and preserve our food. Wash our hands. Make sure things are clean. Keep rats away. Keep droplings and so on away from homes and so on. This is something that we should do all the time. Not just, you see, when the way we move around, to me, is a pointer to the fact that we should not restrict ourselves to the 10 states. When we do so, I think we will go off the track.
You directed that the treatment of the Lassa fever should be free. So have you been able to ensure that every Nigerian have access to the treatment of the Lassa fever?
Well, no one will. One of the things we've also done is to alert healthcare workers about the possibility that any unusual presentation, any malaria that is not responding to chloroquine or the new combination drugs should be promptly referred to appropriate hospitals where they could be taken care of. I can assure you that no one will keep a suspected viral hemorrhagic fever at home. It will be too dangerous. We are also hoping that we will not have an hospital-acquired infection. When we have that, then we're in trouble, because with an hospital-acquired infection, the health facility itself will be suspect and might have to be closed down.
Are there isolation centers for the treatment of Lassa fever in Nigeria?
No, almost all our facilities have isolation wards, infectious disease units, where infected people could be kept. But what we have at least 5 centers in the country that can diagnose Lassa fever. We have a facility in Kano, in Abuja, in Irua, Ibadan, and Lagos. So we are appropriately equipped to make the diagnosis. On a long-term basis, we want to partner with the states to ensure that each state has at least one functional laboratory that can make a diagnosis.
Do you think the 5 diagnostic centers in the country is enough to cope with the Lassa fever in 10 states now?
Well, they will be, because currently we have just about 80 cases, and I think it is 6 or 81 cases, and about 39, 40 fatalities. So that's what we have. Those 5 centers are enough to cope with them.
So now let's examine international best practice now. The notification of the World Health Organization, how expedient is this in health practices globally?
It is our international obligation to notify WHO and other international agencies of the current outbreak, and we've done that. And this morning we also had a technical stakeholders meeting with WHO and CDC to review what we've done so far and what has to be done. We are working on both a short-term plan and a longer-term plan to ensure that next year this country stays free of Lassa.
So tell us your findings about the investigation so far on the resurgence of the Lassa fever.
I have deliberately refused to call it an upsurge of Lassa fever, because if you had 1,800 cases in 2012, you have 1,011 in 2013, 900 in 2014, 400 in 2015, and 80 in 2015-16. We can't call it an upsurge. It's more or less a persistent thing. And so what we want to do is to break the transmission and ensure that next year this country can be Lassa fever free. And that's what we're going to do. Our observation revealed lack of knowledge, lack of awareness, poor identification, lack of reporting framework. These are findings, and we need to really be on alert.
In terms of funding, because the treatment of this Lassa fever in terms of prevention and cure, one could say that's a capital-intensive project, especially in these 10 states of the Federation. So how would you describe this emergency funding?
Well, as I've mentioned, health is not just the responsibility of federal. When an emergency, the federal must intervene. What we've done so far is to distribute drugs that we have in stock, because we must be prepared for an eventuality like this. We've dispatched the drugs that we have. I've approved a request to buy additional 60 million worth of drugs. We are looking at a plan to spend another 140 million to actually move around the states. So, and we're also developing a longer term plan, which we want to pass on to some of our funders for support. So I think with respect to funds, we're quite okay.
Now, it's expected that the federal government should be flagging out its plans for the year. Could you tell us your priority areas as you flag off the health agenda for 2016?
Well, we've been quite clear. I think for this administration, what we want to achieve is universal health coverage. And we've been quite consistent, quite clear about what we want to do. This administration will be known and remembered for being an administration that is pro-poor, an administration that has taken the interest of all Nigerians into consideration. And we are offering health to at least 100 million Nigerians in the next 2 years. And we are looking at affordable health care. For the poor people, it will be free.
Now, 221.7 billion naira has been budgeted for the health sector, which has been presented to the National Assembly. So how do you intend to utilize these funds?
Well, that fund will be used by the national. We are giving a large chunk of it to National Primary Care Development Authority because we want to focus on primary care. We will take care of tertiary institutions and also take care of agencies and also, in fact, implement our international obligations. We have commitments for partner funding. We have quite a number of international support for vaccines, family planning commodities, and we have commitments to put money on ground so that our partners could also, in fact, put theirs also into the basket. That's what we want to do. With respect to universal health coverage, what is in the budget will partly cover what we want to do. We are coming out big, and Mr. President will flag off universal health coverage very soon. We will officially launch the official gazette documenting the Universal Health Act, the National Health Act, and to me, this will signpost the beginning of something great in this country.
You can also be part of this conversation by sending us your comments on our various social media platforms showing on your screen. Coming up on Question Time, what happens to the several international grants offered to Nigeria's health sector? Join us again.